All right, you guys, I am so excited to have Elise on the show with me. It's Elise Joan. She is a Beachbody master trainer and the creator of a program that I can't stop talking about. It's called Barre Blend. And Elise, I'm just going to say a couple words and then I want to dive into our topic, which is really, I want to talk about barre fitness and maybe a little bit about Pilates and pelvic health. So I'm so excited. I know you're an expert on this. And the reason I love you and your program so much is because it focuses on three of the things that I'm completely obsessed about, which is alignment, pelvic health, and hip circles. These are these are literally like my signature things. And I'm just so excited that because my goal is to bring this type of movement into the mainstream, and I'm really doing it by way of YouTube. But at least you have created this amazing fitness program that's bringing, you say the word pelvic floor in the Barre Blend workouts multiple times. And it's like, yes, every time you do it, I'm thinking, yes, you're bringing this to the people. So I'm going to zip my lips now. And I want to just ask you, why is it that you are focused on those issues?
Well, it's a great question, and thank you for having me. It's no secret that my demographic and my passion and my purpose is empowering women, and that's physically, emotionally, mentally. I love my men too. We have a lot of guys doing barre. But for me, as women, we take on so much in this world, right? Physically, emotionally, we're conditioned to be everything to everyone at all times. So I basically use, kind of fitness as a conduit for the lessons that I'm teaching for life off the mat. And those are all about alignment and connection to our powerhouse for women. Our center of gravity is in our hips. So much of our ability to give birth and recover from childbirth is located in our hips, in our pelvic floor, the muscles of the transverse core and the muscles of the pelvic floor, of course, as we know, are responsible for actually pushing during labor and delivery. So many of my clientele is expectant moms, new moms, and then women who've had struggles recovering. My sister-in-law, for example, even a year and a half postpartum, I'm still giving her pelvic floor exercises because of something she's had. And I've seen the power of this kind of work to help with that. So I think that's the main reason I feel like as women, when we feel our best, and this is independent of aesthetics, which are also great, but when our body is aligned, when we have mobility and stability in our hips, when we know how to properly engage all aspects of our core, a lot of fitness, especially male-driven fitness, is focused on the upper abdominals because it gives you that kind of shredded, rippling six-pack external core that predominantly men, but a lot of people want. And I'm focused more on, the full girdle of the core, how it supports our body and how it can support us. And I think as women, when we feel our best, we're able to optimize our purpose in life, whatever that is.
Yes, so well said. And that's another thing I love about your program is it's so uplifting for the mind, body, and spirit. I just look forward to it every day. So about that, yes, I agree that many male-driven fitness programs that are out there, a lot of mainstream, ab blasting programs are more upper ab driven. And if women or men, but really we're thinking about women because of the anatomy of our pelvic floor and what many of us go through. If we're not properly engaged from below first, our pelvic floor first, that's kind of my refrain is pelvic floor first, or I like to say zip up, which you say too. And that kind of bottom up engagement of the core is so key. Yeah.
It's like anything, right? You have to build on a strong foundation. So the foundation is key, and the foundation of our core is those muscles of the pelvic floor. And a lot of women may not even know how to engage or release because we want to relax and engage the muscles.
Oh, yes, girl.
Some of you may know like 360 breathing and all these pelvic floor exercises that are for pre and postnatal and things like that as well. But it's like with anything, the foundation of how you place your feet is important because it works its way up the body and creates imbalances. So I think the same is true of the core, and especially for women, it's such an important area to work. And I try in Barre Blend to help women identify, what it feels like with secular cues that can help women kind of identify what those muscles are, how to contract them, how to relax them, and things like that can help us even be, it's hard to become aware of our own bodies as women. And I don't know if this is taboo, but our sexual organs are internal, right? So it's not something you can see and manipulate. We have to kind of understand how all of that works. And it's hard to identify different muscles. Like if I said engage your transverse core, I couldn't do that just seated. So I create workouts that allow us to kind of, this is what it feels like. And I try in Barre Blend too to explain the why. right? Because I want to know why I'm doing this particular exercise.
Yeah, for sure. I love it. So I want to ask specifically about two conditions. And I know one of them I've actually read from participants in Barre who have really experienced great results with diastasis recti, or the, that can happen so often after childbirth. So tell me more about any cues you may give to people who have issues with diastasis recti and or prolapse. A lot of my audience struggles with prolapse. So what kind of cues would you give for, or modifications or any helpful hints would you give for people suffering from either of those conditions?
Yeah, well, diastasis recti first, let's go over that first. And one of the important components about that is where on your journey of diastasis recti you are, right? And it's not just about the finger width, but also the depth, right? Like so there's different things. If you're early on in your stage, you're immediately postnatal or prenatal, and of course in your third trimester, you shouldn't be doing forearm planks or supine curl positions. And we do some of those in Barre Blend. So for my third trimester mamas or my anyone, because diastasis recti can happen to anyone. It's not just women even, right? So heavy weightlifters and things like that. So anytime you have too much intra-abdominal pressure, that's essentially what can cause that to happen. And a lot of times people think more core work, and it's actually, depending on where you are, you want to release the pressure on the inner abdominal pressure, so the linea alba and all of that. It's very sciencey, but I guess the answer to your question is if you're progressing in diastasis recti and you are, it's healing and you have maybe 2 fingers or less, and you have a certain amount of pliability there, you can do those core. But what I love about Barre Blend is there's a lot of standing core work, and this is standing core work, kneeling core work, even seated core work, where you don't have to be supine and you don't have to be in a forward plank or hands and knees. So I tell my moms to focus on that, and some of the cues I give, you just want to be aware. It's all about what we call like the rate of perceived exertion, right? So especially in online fitness, I can't measure your heart rate and things like that for cardio, and I can't feel your body for you, right? So I try to, throughout the program, help us develop an awareness for what it should feel like, the difference between intensity that's therapeutic and pain that's detrimental. So kind of give cues like that throughout the program. And I would say this is a fabulous program for women who are dealing with those issues once you've been cleared by your doctor. Because if you have more than a 3-finger width, or you do want to consult a physical therapy professional and your doctor and see. But working on engaging, working on breath techniques that can help you also release, things like that are very helpful. And prolapse, that's a very challenging and very personal condition, right? And it can be very difficult, and it can be prolapse is one of those things that in my experience has discouraged women from trying to work out, because jumping and things like that clearly are going to be not ideal, right? Whether you're dealing with leakage or you're dealing with other things, and when the organs fall like that. So the great thing about this program, you can get a lot of high intensity cardio with no impact, meaning neither foot leaves the floor, or low impact where at any point you're stabilized by one foot. So I think it's ideal for women, recovering from prolapse or dealing with that, and it can actually help heal by engaging the muscles of the pelvic floor, working the transverse core in a supported way, and just really offering that support. Because prolapse is tough. I've dealt with a lot of new moms who struggle with that issue, and being sedentary is not the answer.
I agree. And so the one specific move, I know I can't keep you for much longer, but one specific move that I just want to know for myself is a low C curve and a high C curve when you're dealing with prolapse and or diastasis recti, because in my opinion, both of those are going to have the same potential problems in those positions, but they're great. So I don't want to say that they're, out, but I do think they have to be done with care. So what is your take?
That's right. You're exactly right. They do have to be done with care. Also, depending on how severe your condition is that you're dealing with, any of these things, even SI joints and other kinds of, pelvic pain. Because I have had some SI issues from my dance days when they artificially contorted you. But in Barre Blend in particular, there are some standing versions of the C curve where we come to second position, which is an external hip rotation. For some women, that may be too aggressive. You can take a standard squat, narrow hip width, depending, and, kind of work those muscles of the pelvic floor. There's some great exercises out there online too, to help you practice engaging and relaxing the muscles of the pelvic floor. So C curve, I agree, it is important when you get to a point where you've been cleared by your doctor, you feel good, good. You can try the classic C curve. For me, I prefer low C curve for this particular situation because your spine is supported by the mat, your sacrum is supported, everything is supported by the mat. So you're not trying to balance on your sits bones or leaning back. So it eliminates that whole thought process and allows you to really focus on pulling in and up with the different muscles of the core differently. So, you always want to be cleared by your doctor. It is safe to do. I have a whole probably 50 minutes total worth of barre basics and barre tutorials that a lot of people don't watch because they think they're boring. They're not going to break a sweat. Okay, you're not going to break a sweat watching the barre tutorials, but you will have so many more results, so many more safe results if you review the barre tutorial, because every question I get asked about poses is a question that I've covered in the barre tutorial. So something like this, and it's key listening to your body, because again, with prolapse, with diastasis recti, with any kind of postnatal, if you've had a C-section, right, all of these things impact how comfortable we're going to be in certain core moves. And I think the best thing, which is I've watched your YouTube as well, and some of the things you talk about too, is just understanding how it feels for you, right? Yeah. And knowing, okay, this is how to do that, and kind of giving the cues that allow for that.
Yeah,
and sure. We really want to think about those muscles. Sometimes we think our core ends at our belly button. It like barely begins there, right? So we want to think about like at the lowest abdominals you can possibly imagine, like 3-4 inches below the navel, like really bring your mind to that. And that's why I think the low C curve empowers that, because first of all, you can hold on. Secondly, you put your forearms down to prop you up in the position. So you're engaging a little less upper core, but it still gives you that mental capacity to connect with your pelvic floor, your transverse core, your front abdominal wall, the low front abdominal wall. And we remember not to be too critical of ourselves as women, right? Because especially if you're in your childbearing years, like your body is protecting that area that's why you have a little, like everyone calls it a kangaroo pooch. I think that's so disheartening. Like we have softness there. We're women. Unless we're in elite athlete training mode, we're not really meant to be like, have a rippling six pack all the way down to our pubic bone, So a little patience with that, but the strength does come. And, I think these kind of workouts really help with that aesthetic that's below our navel for women. That can be our problem area.
Oh, so beautifully said. Thank you, thank you, thank you. I completely agree. And I love the idea of modifying with the standing versions. I love that standing version. And then the elbows behind, and then the holding on. But I also agree that low C curve, when done right, is so effective.
Yeah. It just, it's the whole premise of the program, which is still a struggle for me to message, is letting go of your ego.
Yes.
Your ego. I always offer 3 tempos. I'll set up the movement, in cardio even, and the movement and then I'll go to the regular tempo, and that's a tempo, and then I'll go to the third tempo, and everyone wants to go fast. That's why there's 3 levels. The intensified is designed really for elite athletes and professional dancers already. And just to message that, today I'm starting my 4th round of Barre Blend, because I had the creation of it, the test group, the filming. Oh wait, the creation, the test group. Well, the creation, I guess I didn't really count. The test group, the filming, my round 1, which I just finished, and now everyone's round 2. And I'm barely at the mid-level. Maybe for the last 4 reps of the intensified, I'll add the jumps, but not really. So I think as women, it's another good lesson, right? Don't worry about keeping up with the intensifier. Don't worry about keeping up with the tempo. The tempo is there because we had to film at a tempo. We wanted the cardio intervals, and it would be confusing to have the modifier at her own pace. But I constantly say, please go at your own pace. Please press pause. Please review the barre basics, and you really can set a strong foundation for any level to really thrive.
Yeah, absolutely. And if anyone's wondering, I also follow the mid-level. I do not barely ever intensify. So I also have to put the
so you're like, you can still get killer results. I designed this program for your audience, essentially, right? I didn't do the modifier where it's just like, if you want a modifier, just skip everything. No,
right.
The program is designed around the modifier and then up leveled from there, as opposed to designed for craziness and then down leveled. So I want to really message that it is designed your first round through to really focus on your alignment, the identifying of your rate of perceived exertion, how it feels strength wise and cardio wise. And then round 2, maybe go up to the mid-levels. Yeah.
Absolutely. Oh my gosh. Thank you so much. I know you've got to run. I really appreciate you
fitting me in across international time. I love you. I've loved connecting with you personally on Instagram. I've loved seeing your work, and I love aligning with other women. And what a great time, International Women's Week, year, life.
Yes.
For me, it can't just be a day, right? But really appreciate all of your audience who are just being women and thriving and learning that, you know, when we rise into our real power and we connect to our core, we are limitless.
Absolutely. Yes. Oh, thank you. Thank you. Thank you.
Thank you.
Huge love to you. Mwah.
Have fun over there in Germany. Enjoy your evening.
I will. You have a great day too. Bye.
Bye.